And welcome to another show, another week here at the Healthcare Business Network. This is Ron Nyman speaking to you again. And we have another exciting episode on another important topic in the world of the business and healthcare, where business and healthcare is our business. So I want to take this opportunity to tell you that we're going to be talking about ICD-10 this week, the implementation of ICD-10, which has been a topic that I've been receiving quite a bit of email on for the last several weeks. So I thought it'd be a great opportunity to take this episode this week to discuss implementation of ICD-10. And our expert this week is Holly Louie. Holly is the Corporate Compliance Officer for Practice Management Incorporated. She's been there for several years now, and she's also served as a consultant in a variety of areas, from doing performance analysis and risk assessments of billing companies. She's also done expert coding reviews and analyses. She's also provided expert support in the fraud and abuse case area, and she served as a compliance resource for attorneys, physicians, institutions, and billing companies. Among the many things that she participates in the healthcare arena, Holly also sits on the board of directors of the HBMA, that's the Healthcare Billing and Management Association, which is the leading trade association for third-party billing companies in the United States. Under the HBMA, she serves as chair of the National Coding Committee, or served as chair of the National Coding Committee, and she also currently serves as co-chair of the National Ethics and Compliance Committee at the HBMA. In addition to that, she is a co-developer of the Compliance Implementation course for billing companies at the HBMA. And a very important area amongst the many that I've told you about that Holly had the opportunity to participate in, she assisted in the draft revisions of the OIG, that's the Office of the Inspector General for Health and Human Services. She assisted in the draft revisions of OIG guidance for third-party billing companies. She's also served on the Board of Governors for the American College of Medical Coding Specialists, that's the ACMCS. And just to round things out, Holly has quite a bit of clinical expertise too. She's a registered nurse. So she's seen both sides of the coin, both the clinical side as a nurse and, of course, as the business side. So, Holly, I want to take the opportunity. It's a great honor to have you here on the Healthcare Business Network.
Thank you, Ron. I'm glad to be here.
Well, it's great to have you. So I guess what we really want to start out with in discussing ICD-10 is if you could give us a brief overview of ICD-10.
Sure. Really, what ICD-10 is in a nutshell is a complete replacement of ICD-9 codes as we currently know them for diagnoses. And it will also completely replace how hospitals code inpatient procedural services with ICD-10 PCS. So we're completely replacing two systems that we have used for many years.
And this is going to be a complete, I believe, as you said, a complete overhaul of the diagnostic coding system, correct?
Well, it's not really even an overhaul. It's throwing out what we use today and starting with completely new information. There's no revisions or updates or adding new digits like we're used to. It is starting over with completely new code sets.
So this is almost like a blank slate we're starting with here.
Exactly.
And what would you say, if you could categorize briefly, what would you say are the major changes from ICD-9 going to ICD-10 that people are going to see immediately?
For the diagnosis coding piece, I think the biggest changes are going to be the vastly increased specificity and detail that the new code sets afford. It's much, much more than what we're used to, very specific down to, for example, the distal digit of the fifth finger on the right hand, and whether it's an initial visit, a subsequent visit. So there's much more information to be captured for statistical analyses. On the PCS side, the inpatient hospital procedural coding piece, it is so vastly more detailed in systems, techniques, equipment, all kinds of additional information we've never captured before.
Now, In a nutshell, what would you give as the important dates for the transition to ICD-10? What would you say is the schedule that people have to be aware of and keep their eyes completely open for in the next few years?
Okay. The official implementation date is October 1st, 2013 for ICD-10 implementation. As recently as last week, CMS reconfirmed that date will not move. It is a hard date, and on that date, all HIPAA-compliant entities will be required to use ICD-10 codes. So
that date, you would agree, some people might say, well, that's 2 years around, but that's really right around the corner in terms of preparation.
Exactly. It will come very, very quickly.
Right. And are all insurance payers switching to ICD-10?
Well, some payers who are HIPAA exempt, not really health plans, but, for example, workers' compensation, auto, other indemnity-type programs, are not required by law to utilize the standard transaction subs. Information in the industry to date is that some of those will not transition to ICD-10, which greatly complicates the billing industry because you will potentially need to report both ICD-9 and ICD-10 codes for the foreseeable future, and you will have to have systems that can accommodate both sets for the foreseeable future. So,
if I were an owner of a software company, I would really be pulling my hair out in terms of the amount of work that's going to have to be required to maintain two coding systems.
Exactly. And some billing systems and software systems currently in use are simply not able to accommodate both sets at the same time. Some are, but it's going to require a lot of work.
Do you see any requirement coming down the line between now and 2013 where the requirement could be made that all insurance carriers have to move to ICD-10, or you just think it'll be something that's voluntary on their part and we're going to be dealing with a lot of chaos?
Well, considering it would take congressional action to make that federal law, I don't have high hopes to see that. I think we're going to have to work with our payers to encourage them to transition, but I don't see it being legislated at this point.
And what have you seen in terms of the insurance carrier community? Have you seen much in terms of wanting to cooperate, where they're not necessarily, certain carriers aren't required to switch over to ICD-10, or it's really too early to tell?
I think it's really too early to tell right now.
Okay. Well, listen, we're going to take a break right now. When we get back, we're going to talk to Holly about the things that you need to be doing right now to effectively prepare for ICD-10, things in your office. What about training your staff? What do you need to be communicating to your vendors? So we'll get to those issues when we come back after a word from MediStar.
Are you looking for a billing company that can increase your revenue, effectively manage your credentialing, deliver the right software, and provide guidance in navigating the minefield of compliance? MediStar has been providing the right answers for hospitals and physicians for over 13 years. We go the extra mile by paying attention to the details and focusing on aggressive follow-up. Recognized for 4 straight years by Inc. magazine, our professionals can help you attain your revenue cycle goals while helping to ensure that your work is done in a compliant manner. Call one of our experts toll-free at 888-423-8080. That's 888-423-8080. Or visit us at www.medistarbilling.com.